So we're coming off the pandemic, people being quarantined, and then now summer. So during summer, kids get off their sleep schedule. They tend to be snacking more, probably eating a little bit more junk food than normal. So definitely just getting back to a more routine, getting kids going to bed, waking up at certain times that give them adequate enough sleep, at the minimum 8 hours, but most kids even need up to 10 hours. And then just working on good nutrition. That's gonna help their brains function better and their bodies function better in school. You know, eating their fruits and vegetables, trying to get lean meats, and limiting the sweet drinks and the packaged food like chips and crackers and things like that as much as possible to just help start them off on the school year right. And hopefully, you know, just any weight that they've maybe gained during the COVID pandemic in summer, we can start getting that to come off, or at least not continuing to gain weight. Definitely not missing your child's well check appointments if you are noticing any increase in thirst, increase in urination, wetting the bed or waking up at night to urinate, especially in older kids that have been dry at night for a long time. And then if they're losing weight, especially at a rapid pace, even though they're not trying to lose weight, more tired, more irritable, any of those things are red flags for type 1 or type 2 diabetes. And so very important to get your child to the pediatrician. They can do a simple urine test or a finger stick and be able to test their blood sugar levels. And they can, you know, send them here if they need to, or call us for any guidance. Especially with type 2 diabetes, sometimes the symptoms are not as fast as an onset as type 1. So if your kid is very overweight, if you've noticed any of this darkening on their back or the neck, there's a term called acanthosis nigricans. That could be a sign of insulin resistance or pre-diabetes. And so it's important for your kids to have their health checked so they can be screening their A1C, which is the diabetes screening test, to make sure that they're not pre-diabetic. So then you can be working on those healthy lifestyle changes to hopefully prevent them from developing type 2 diabetes at a young age.